Hi, everyone, and welcome to this webinar brought to you by the Dental Academy of Continuing Education. Tonight's event, Hydroxyapatite, a fresh approach to remineralization, discussing the evidence on hydroxyapatite use in oral care products by Dr. Derek Gatta. This webinar is both live and interactive, so you can ask questions by typing in the Q&A box. We will answer these questions as we are able at the end of the webinar. To receive your credit, we kindly ask you to complete a brief survey. After the survey, you will automatically receive your certificate. There will not be a course code tonight. Endeavor Business Media is an ADA CERP recognized provider and an approved AGD PACE program provider. This webinar presentation is approved for 1 AGD continuing education credit. Please take a moment to review this slide. Tonight's presenters do have a financial or leadership relationship to disclose related to this continuing dental education activity. Tonight's continuing education is brought to you by an unrestricted educational grant provided by RiseWell. Images used in this presentation have not been altered from their original state. Images that have been altered for educational purposes will be fully explained and disclosed to the audience during the presentation. Please take a moment to review this slide. All right, and now I have the pleasure of introducing Dr. Derek Gatta. Dr. Derek Gatta, a highly accomplished prosthodontist, hails from Newport, Rhode Island. He obtained a BS in neuroscience from Vanderbilt University in 2003 and went on to complete his dental education at Nova Southeastern University in 2009. During his time in dental school, Dr. Gatta was awarded a scholarship with the U.S. Navy, which led to his dedicated service in the dental corps for 8 years. He underwent a general practice residency at Camp Pendleton, California, and further pursued his education with an MS in oral biology and a certificate in prosthodontics at the esteemed Walter Reed National Military Medical Center. Dr. Gatta's professional journey also included deployments in Byron and Newport, Rhode Island, before ultimately settling in South Florida, where he now maintains a thriving private practice in Boca Raton. Dr. Gatta is highly esteemed in his field as a board-certified prosthodontist and a diplomat of the American College of Prosthodontists. He remains an active member of several prestigious dental organizations, including the Academy of Osseointegration, IPI, and the American Academy of Cosmetic Dentistry. Now, please enjoy tonight's presentation. Dr. Gatta, take it away.
All right, well, thank you for that kind introduction. Welcome to this evening's presentation. Very excited to be here to illuminate your minds and discussions on all things hydroxyapatite. So in our agenda tonight, we're going to be looking at what in the world is hydroxyapatite. There's a lot of buzz around the internet, social media, online sources looking at this molecule that is relatively new to our US market, but it's been around for decades. We're going to be diving into how it works. We're going to be looking at types of hydroxyapatite. We'll be discussing the evidence. We'll be looking at fact versus fiction. And lastly, we'll have a Q&A session at the end to answer your questions. So what in the world is hydroxyapatite? According to a study in 2021, it is estimated that roughly 35% of the population has untreated dental decay. While fluoride has been a cornerstone in the prevention of dental caries, there is a need for effective alternatives due to the decreased acceptance among the public and risk of fluorosis in children. Hydroxyapatite-containing toothpaste are fluoride-free alternatives, which have been recently shown to be effective as an anti-caries agent. And it's pretty fascinating too. So hydroxyapatite was first developed by NASA looking at astronauts living in a zero-gravity environment, having demineralization issues in their bones and teeth. And we'll get into that later more in the presentation, but it was kind of fascinating diving in, looking at the research of where this all started. All right, so hydroxyapatite, the chemical structure is quite complex. It crystallizes into a hexagonal structure with calcium, phosphate, and hydroxyl ions distributed throughout a crystal lattice. It is a naturally occurring mineral, making up 97% of our tooth enamel and up to 70% of our bones. It's biocompatible, biomimetic, non-toxic, non-inflammatory, and has anti-biofilm properties. It's been the gold standard in the Japanese oral care market for decades. And as I mentioned previously, NASA first researched the properties of HA to help remineralize the teeth of astronauts returning to Earth. All right, so where is it found? Hydroxyapatite, or HA, can be obtained through two main sources. HA can be extracted from various natural materials rich in calcium phosphate, such as calcium phosphate rock, animal bones and scales, eggshells, and seashells. Now, synthetic HA creation involves chemical reactions using raw materials like calcium carbonate, calcium hydroxide, and phosphoric acid. The specific process can vary, but it often involves wet chemical techniques or solid state reactions followed by heat treatment to achieve the desired properties. All right, so is it biocompatible? HA is biocompatible, making it a uniquely valuable mineral for both medicine and dentistry. The medical uses of HA include bone regeneration. HA is widely used in bone grafting and repair procedures. Surgeons can use synthetic or natural HA to fill bone defects caused by injury, disease, or surgeries. HA has osteoconductive properties, which provides a scaffold for new bone growth. In addition, researchers are exploring the potential of HA nanoparticles as carriers for targeted drug delivery within the skeletal system. HA's slow and controlled release properties could be beneficial for delivering medications to treat bone diseases. Investigations are ongoing to explore the use of HA in other areas of medicine. For instance, HA may be used in treatments for facial bone reconstruction, ear surgery, and certain types of implants. In dentistry, HA has been used in grafting, implant coatings, and toothpastes, providing an alternative to fluoride. All right, so this is fun. A little history on HA and really diving into how did we get to where we are currently. And now, as mentioned previously, NASA was a big player in this process. NASA began researching the use of HA for bone repair in the late 60s and created a patent on using HA for tooth repair in 1972. Dr. Ira Shannon, a NASA dental consultant and contractor, developed the first HA ingestible toothpaste in 1984 called NASADent, designed for use by astronauts during a space mission to address the challenges of oral hygiene in space, where traditional toothbrushing and rinsing methods were impractical due to the absence of gravity. NASADent provided a solution for maintaining oral health in the unique environment of space travel. NASA used HA as an alternative remineralizing agent to fluoride because it is both effective and safe to be ingested. I can imagine brushing in zero gravity while not being able to spit could be a challenge. So having something safe to ingest would be critical. NASA's patent on HA was purchased by a Japanese company named Sonji and developed its first HA toothpaste in Japan in the 1980s called Apodent. Finally, in 1993, the Japanese government began recognizing HA as an anti-cavity agent. Since then, several countries have integrated HA into their oral care markets. It's been the gold standard, representing over 50% of the Japanese oral care market, came to the European Union in 2006, arrived in Canada in 2015. RiseWell was the first HA company created in the United States in 2017, launching its first HA toothpaste in 2019. Although HA has been around for over 3 decades in the oral care products around the world, it had not emerged in the US market for a while. RiseWell co-founders were looking for something that was both non-toxic and effective while undergoing the IVF process. Decades of research has showed HA as an effective, non-toxic fluoride alternative. All right, so we're going to get into how does hydroxyapatite work. To understand the mechanism of action of HA toothpaste, it is essential to understand the structure of enamel and how it breaks down during the caries process. The main inorganic component found in dental enamel is hydroxyapatite, which is a mineral composed of calcium and phosphate ions. Hydroxyapatite crystals are highly organized to form compact enamel rods, which extend from the dental enamel junction to the outer surface of the tooth enamel, which are surrounded by enamel interrods. The highly organized three-dimensional structure contributes to the enamel's ability to withstand force, resist microbial attack, and reflect light. So this review of dental anatomy just really helps to highlight the structure of a tooth and how it looks here. So again, a quick recap: the structure of enamel, you've got the hydroxyapatite crystals. They provide the strength and protection to the underlying layers of the tooth. You next have a protein matrix. This holds the minerals together. These proteins contribute to the flexibility and resilience of enamel, helping it withstand chewing forces and resist fracture. You also have enamel rods. These extend from the DEJ to the tooth's outer surface. Each enamel rod consists of tightly packed HA crystals aligned in parallel to the long axis. This arrangement provides strength and resistance to compression forces. You also have something called the interrod substance. This lies between the enamel rods, also contains hydroxyapatite crystals, but much less densely packed compared to the rods. The interrod substance provides additional structural support and helps fill in spaces between the enamel rods. The outer enamel surface is highly mineralized and smooth, forming a protective barrier against acids, bacteria, and mechanical wear. This surface is critical for maintaining the integrity of the tooth and preventing decay and damage. So that review should be helpful for a little dental anatomy of what we're looking at before we dive into the demineralization process. So again, understanding cariology and how this step goes. The caries process is multifactorial. At the molecular level, it is characterized by a loss of mineral from the hydroxyapatite lattice. Specifically, the metabolism of carbohydrates by oral bacteria causes an initial drop in pH as a result of the lactic acid production. When the pH of the oral environment drops below the critical value of 5.5 for enamel, the increased hydrogen ions couple with free calcium and phosphate ions to shift the equation to demineralization, which causes the dissolution of hydroxyapatite crystal, resulting in the loss of calcium and phosphate from the tooth structure. In a supersaturated solution of hydroxyapatite in the saliva, the calcium and phosphate are driven back into the tooth, remineralizing incipient lesions. So this next graphic is helpful to illustrate that as well. You really want to go back to cariology and a quick review of what all dentists know, but looking at the Stevens curve after a meal, when you consume and start digesting food in the mouth, the pH from the fermentable carbohydrates will drop. You enter a slightly acidic zone. That acidic zone is a breeding ground for the demineralization process. Carious bacteria can start contribute to using that food source of the meal you just ate, contributing to the acid production, which leads to weakening of the enamel structure. Again, that graphic is pretty helpful too, because you can see some of the driving force. Once the acids are present, the calcium and phosphate are lost in the outer surfaces of enamel, leading to demineralized incipient lesions. Now, luckily for all of us, this process is reversible. Before it turns into a physical hole, you can remineralize or re-strengthen using hydroxyapatite. And how does that work? Well, hydroxyapatite remineralizes teeth through a process involving these steps. Number one, dissolution. When you brush with HA toothpaste, the HA crystals in the toothpaste partially dissolve and release calcium and phosphate ions into your saliva. The ion exchange occurs. These calcium and phosphate ions then migrate towards the tooth enamel surface. The tooth enamel itself is composed of HA crystals, but over time, due to factors like acid erosion or bacteria, these crystals can lose some minerals. And step three, recrystallization. The available calcium and phosphate ions from the toothpaste can interact with the tooth enamel surface and integrate in the existing hydroxyapatite crystals. This helps to fill in microscopic gaps and strengthen the enamel structure. So I hope that overview helped to illuminate and then serve as a good review for the demineralization and remineralization process. Again, you've got a pretty sweet scanning electron micrograph photograph here, looking at how the hydroxyapatite can rebuild an enamel-like structure over demineralized areas, looking at um, the one picture showing the lack of the outer enamel and the photo on the right looking at the new biomimetic shield of hydroxyapatite that has replaced the incipient lesion there. So it's a pretty remarkable compound. So the HA bonds with existing tooth enamel. The tiny crystals can penetrate into incipient lesions and adhere to the existing enamel and dentin, replenishing demineralized areas of the tooth. This is also results in a smoother, whiter tooth, making it more difficult for plaque and stains to adhere to it. HA is also remarkably effective at reducing sensitivity. So forging ahead, this is pretty interesting study out of Texas here, looking at a double-blind study using 500 parts per million of fluoride versus 10% microhydroxyapatite. You can see in those images here, the study was used by 30 participants, and they had enamel blocks bonded to their actual teeth in their mouth to simulate or actually be in the oral environment. And they were instructed to brush using either one or each one or the other type of toothpaste. Now, the black line in picture A simulates the demineralization that has occurred from ion loss. In photos B, you can see the top one is using 500 parts per million of fluoride, where you still have a pretty prominent dark band, a little surface remineralization at the top, and that's characteristic of fluoride. In the lower photo of B, you see the hydroxyapatite test study. Now, those folks were using the 10% micro HA, and you see much more homogeneous remineralization characteristics of the process, which is indicative of hydroxyapatite versus fluoride. So, really interesting result there. Hydroxyapatite, excuse me. So again, looking at this, it really goes to show that the HA is effective at remineralization. So again, we all know that fluoride works. It's been pretty well documented with decades of research. It has efficacy to also cause remineralization. But let's talk about fluoride for a moment here. So it has some advantages. It also has some drawbacks. So the fluoride incorporated into the tooth structure called fluoroapatite, it is more resistant to acid attack and decay than hydroxyapatite, making the enamel stronger and less susceptible to decay. Fluoride works, but there are a few issues to talk about. Fluoride does not supply its own calcium and phosphate. Saliva supplies the calcium and phosphate for remineralization. Therefore, healthy saliva must be present for proper remineralization. This is a problem for the population with xerostomia, which seems to be growing by the day. How many of your patients are on medications? How many of those medications have side effects of xerostomia? It seems like many. It's a story I hear all too often, especially in the geriatric population, where root decay runs rampant in dry mouth individuals. Fluoride is a toxin when ingested. When you look at the back of the toothpaste label, it says, call poison control if you swallow too much. Well, how much is too much? I don't know, but that's something to consider. The efficacy is dependent on the dose. In children who are high risk for decay, you can't give them a higher dose because it's just not as safe in those individuals who can't control their swallowing muscles. So all things to consider. Forging ahead, looking at the 5 advantages of hydroxyapatite. All right, so hydroxyapatite again, biocompatible, mimicking the natural and original structure of tooth enamel. Hydroxyapatite is non-toxic, can be ingested with 0 side effects reported, just as effective at remineralizing teeth. HA's concentration can also be safely increased for better remineralization without compromising safety. HA does not rely on saliva for its source of calcium and phosphate to remineralize teeth. It is especially suitable for the xerostomic patient population. Studies report that HA naturally whitens teeth, where no significant shade difference was found when using fluoride. And also, HA decreases hypersensitivity by effectively creating tubule occlusion, while there is no significant difference with fluoride. So all those five advantages are pretty striking when comparing it to the traditional way we try to remineralize teeth. All right, so hang with me here. So we're also going to be looking at particle size. Hydroxyapatite routinely comes in two different size formulations. Excuse me, you've got a micro-sized particle and a nano-sized particle. And we're going to dive into that for briefly. So both micro and nano HA crystals can provide benefits when used in toothpaste formulations, including remineralization, desensitization, and surface smoothing. Nano HA particles may offer advantages in terms of enhanced remineralization and surface smoothing due to smaller size and higher surface area. However, the choice between micro HA and nano HA toothpaste ultimately depends on individual preferences, oral health needs, and considerations regarding safety and efficacy. Nano HA particles typically range in size from tens to hundreds of nanometers, which is incredibly small, thousands of times smaller than the width of a human hair. Micro HA particles are much larger, typically ranging from 5 to 10 micrometers. While still fine, they are significantly bigger than nano HA particles. All right, so how's it made? Nano HA is most commonly chemically synthesized using various methods, each with its own advantages and limitations. Micro HA can be created by obtaining calcium phosphate from a natural source and undergoing either a chemical or non-chemical synthesis process. Different synthesis methods are chosen to produce particles with specific sizes, shapes, and properties suitable for various applications. So I hope that's helpful looking at the different size of HA particles. Moving right along here, both micro and nano HA are biocompatible materials that are safe for use in oral care products. However, nanoparticles may raise concerns when their potential for systemic absorption and long-term health effects. While research suggesting that nano HA particles in toothpaste are unlikely to be absorbed systemically in significant amounts, the European Commission on Consumer Safety, the SCCS, conducted an 8-year study evaluating the possibilities. In March of 2023, after this 8-year study concluded, the SCCS ruled rod-shaped nanohydroxyapatite to be safe and effective for use in toothpaste of up to 10% concentrations and of up to 0.465% in mouthwash. The nanohydroxyapatite used in the European SCCS study was NanoSim's care paste by the manufacturer Fluidinova. Moving right along, that's important to highlight too when you consider all that you hear on the internet, social media, looking at nanoparticles, but the European Union study did find it safe and effective of up to 10% concentrations in the nano size rod shape. All right, so both micro and nano HA particles can provide benefits when used in toothpaste formulations, including remineralization, desensitization, and surface smoothing. Nano HA particles may offer advantages in terms of enhanced remineralization and surface smoothing due to their smaller size and higher surface area. All right. However, the choice between HA and nano ultimately depends on the individual preferences of the individual. Both HA and nano contribute to remineralization by depositing calcium and phosphate ions on the tooth surface. Nano, smaller particle size, higher surface area, may have a more efficient interaction with enamel and potentially penetrate deeper into microscopic defects, leading to enhanced remineralization compared to HA. Both nano and micro have been shown to help reduce tooth sensitivity by blocking exposed dental tubules and providing a protective barrier against external stimuli. However, nano may have an advantage in this regard due to its smaller particle size, which allows more effective occlusion of dental tubules, providing long-lasting relief from sensitivity. Nanoparticles, due to their smaller size and higher surface area, have a greater ability to fill in surface irregularities and smoothing the enamel surface compared to micro HA. This can result in improved aesthetics and reduced surface roughness and enhance resistance to plaque accumulation and staining. All right, so we're going to dive into the evidence here and really discuss how all these claims are backed up and what's out there in the literature, because it's really important to be driving this conversation from where the science is coming from. So Discussing the evidence, while the use of HA toothpaste to remineralize tooth is new to America, HA is not new. We have 40 to 50 years worth of studies and clinical trials available on the topic, published by various credible educational institutions, peer-reviewed journals, and research sites such as PubMed. Currently, over 37,000 studies can be found on HA when searching. The use of HA in toothpaste has been supported by various studies and research findings indicating its effectiveness in promoting remineralization, reducing tooth sensitivity, and improving overall oral health. Here are some key pieces of evidence supporting the use of HA in toothpaste. All right, so HA toothpaste have been shown to help reduce tooth sensitivity by occluding dental tubules and providing a protective barrier against external stimuli. Clinical studies have demonstrated that toothpaste containing HA can effectively alleviate dentin hypersensitivity and provide long-lasting relief for individuals with sensitive teeth. For instance, a randomized controlled trial published in the Journal of Clinical Periodontology found that toothpaste containing nano-HA significantly reduced tooth sensitivity compared to a placebo toothpaste after 4 weeks of use. HA toothpaste has been shown to help protect against dental erosion caused by acidic foods, drinks, and gastric reflux. Research indicates that HA particles can adhere to the tooth surface and form a protective layer that reduces the loss of enamel minerals under acidic conditions. A study published by the Journal of Dentistry found that toothpaste containing HA provides greater protection against erosive enamel loss compared to fluoride toothpaste alone. HA toothpaste has anti-caries properties due to its ability to promote remineralization and inhibit demineralization of tooth enamel. Studies suggest that the addition of HA in toothpaste enhances its effectiveness in preventing tooth decay. For example, a systemic review published in the Journal of Dentistry concluded that toothpaste containing either micro or nano HA resulted in both types of toothpaste providing significant caries protection compared to a control group, with no significant difference between micro and nano HA toothpastes. All right, well, I hope looking at the evidence and the scientific literature was helpful and informative for everyone out there as well. Now we're going to dive into a fun part of what I want to call fact versus fiction. So we'll jump in and get started here. So first one, fact or fiction. The claim has been made that HA has not been around long enough in oral care products to produce sufficient and credible studies. That's fiction. Not only has HA been around as a remineralizing agent for over 40 years in oral care products, it has produced over 3,200 studies. It is the gold standard for oral care in Japan, makes up about 30% of the market in Europe, and is quickly gaining speed here in the US. Next one. HA toothpaste is just as effective at remineralizing teeth as toothpaste containing fluoride. Fact. Based on the results from numerous comparative studies, both micro and nano HA containing toothpastes of at least 10% concentration have been found to remineralize teeth just as effectively, if not better than fluoride toothpastes. Next claim, HA concentration levels impact efficacy and remineralization. The majority of HA studies are conducted with an HA concentration of 10%. While you will likely see remineralizing benefits from lower concentrations, 10% seems to be the most optimal for results, as comparable to fluoride. Essentially, the more highly concentrated, the better results. Note that while the SCCS has recommended 10% as the maximum concentration level for nano, this safety recommendation does not apply for micro. Hypothetically, you could safely exceed a 10% concentration for increased remineralization benefits if you combine both micro and nano. All right, fact or fiction. The claim is that HA toothpaste is better at addressing hypersensitivity. In virtually all sensitive, that's a fact. Let me just restate that here. So HA toothpaste is better at addressing hypersensitivity in teeth than the leading sensitive brands on the market. Fact, virtually all sensitive toothpastes on the market use pain blockers, such as potassium nitrate, to temporarily reduce sensitivity. HA has the ability to stop sensitivity at the root source by creating tubule occlusion, protecting exposed areas of dentin without the need for pain blockers. All right, next fact or fiction. The claim is that HA can be used as a topical left on the teeth overnight for increased contact time and remineralization benefits. That's true. Fact. While you may want to consider all the ingredients included in the HA oral care market, HA is 100% non-toxic and safe to be ingested. This gives dentists the unique advantage of increasing recommended contact time for better results without the risk of toxicity. When considering all the ingredients in your oral care products, you may also want to see if the products contain other abrasives that may cause concern when left in the mouth overnight. For instance, sodium lauryl sulfate, which is also called SLS, detergents, abrasives are an example. RiseWell does not use these ingredients, could be a good option for overnight use since all food grade ingredients are compliant. No SLS, parabens, or any harsh additives, as one example. Next, the claim is HA is most effective in the alkaline environment. Fact. This is why selecting your HA product is so important. Look for the alkalizing products that also contain ingredients such as xylitol, baking soda, also known as sodium bicarbonate, and calcium carbonate. HA can adhere to teeth in both acidic and alkaline environments, although the conditions may affect its stability and interaction with the tooth surface. Did you know that HA itself can contribute to alkalinity in the mouth due to its chemical composition, which includes calcium and phosphate ions? HA helps to neutralize acids and promote remineralization, thereby contributing to a more alkaline oral environment. HA can still adhere to a tooth surface, but its stability may be compromised due to its susceptibility to dissolution under acid attack. Acidic environments can lead to demineralization of the enamel, where minerals are lost, including the HA. However, toothpaste containing formulations containing HA often include stabilizing agents to mitigate its dissolution and enhance its adherence to the tooth surface. In alkaline environments, HA tends to be more stable and less susceptible to dissolution. Alkaline conditions can promote the deposition and adherence of HA to the tooth surface, enhancing its effectiveness in promoting remineralization and strengthening enamel. All right, so in summary, the pH of the oral environment can fluctuate depending on various factors such as diet, saliva, composition, and oral hygiene practice. While alkaline environments may be more conducive to the HA stability and remineralization, toothpaste formulations containing HA are designed to provide benefits across a range of pH conditions. Additionally, the mechanical action of toothbrushing helps to distribute HA particles evenly across the tooth surface, facilitating their interaction with enamel and enhancing remineralization regardless of the pH environment. All right, so that wraps up the mechanics of hydroxyapatite, the fact versus fiction, and we are open for Q&A.
Thanks, Dr. Gata. We do have some questions, so I'll just dive right into those. Why would I choose a nano versus a micro toothpaste for my patient?
So, as stated in some of the research articles, nano does have a slight increased efficacy in sensitivity. They're much smaller particle sizes to not just occlude and block the dentinal tubules, but actually go into the dentinal tubules. So, a slight advantage for increased sensitivity. Also important to note that looking at the remineralization potential, 10% hydroxyapatite compared to fluoride has been shown to be just as effective as fluoride, whether it's micro or nano. But if you're looking for added sensitivity relief, nano could help those people who have that pesky, stubborn sensitivity that still lingers.
What are the best questions to ask when comparing HA oral care brands?
So when looking at HA oral care brands out there, and I'm really positive and excited to see some of the brands that are out there all contributing to help give consumers options and choice. But transparency is a big deal. Looking at not only the type of HA they're using, but where they source it from. Ask questions, get involved, find out what the ingredients are, and where they source ingredients from, not just what they're using in terms of concentration level.
Why should I recommend HA over fluoride?
So HA, as listed in this presentation, has numerous benefits without the health adverse effects of fluoride. When you look at a molecule such as HA, it's naturally occurring. It's what your enamel is already made out of, biomimetic, uh, biocompatible, non-toxic, non-inflammatory. It has a remineralization potential comparable to fluoride. Also, it's effective at both surface and subsurface incipient lesions, whereas fluoride is usually only effective at surface lesions, leaving subsurface lesions still demineralized. Fluoride also relies on your saliva having calcium and phosphate available. So if you're xerostomach, you're missing key ingredients needed to drive that reaction to remineralize, excuse me, to remineralize and get the calcium and phosphate back into the enamel. So for those reasons, I would recommend the hydroxyapatite over the fluoride.
Is HA used in other oral care products besides toothpaste?
So besides toothpaste, I've seen HA in flosses, mints, and mouth rinses. A good question.
Yeah. How does HA remineralize beneath the enamel surface? Will it help with severe demineralization cases?
So unlike fluoride, hydroxyapatite is able to remineralize not only the surface of enamel, but subsurface lesions by being biomimetic and being comparable to the existing structure of your enamel. It's able to drive in and is attracted to chips in the armor of the enamel. So incipient lesions, both surface and subsurface, have efficacy at remineralization with hydroxyapatite. Now, if the decay has progressed to or beyond the dental enamel junction, research is not quite so favorable in terms of remineralizing past the DEJ. Not that I've seen. So once the decay is past the DEJ, you're probably looking at requiring some kind of dental restoration to alleviate that condition.
Okay. What is the recommended / minimum contact time for efficacy?
So a lot of the studies that have been reported out there in the literature are looking at a 2-minute contact time, which is convenient because that's what a lot of electric toothbrushes are using is 2 minutes to brushing. So that is what a lot of the studies are based on. Excuse me, but also I would recommend because of its non-toxic health profile, after brushing at night, don't rinse your mouth out with water. Leave some of the residue of HA on your tooth enamel to help drive in and give your saliva a supersaturated state of calcium phosphate overnight.
There have been talks that there could be some systemic issues involving HA in the body. Can you tell us more?
Certainly. So I think the thing that's on everybody's mind out there in the literature is looking at, do nanoparticles, do they affect the blood-brain barrier and vascular calcifications? And I think people have to realize that based on the European Union's 8-year study from the Consumer Safety Board, concentrations of nanohydroxyapatite up to 10% in the rod-shaped form and their uncoated particles, all those specifications had to be met to create the 8-year conclusion of safety for the nanohydroxyapatite in that study. I think when you're looking at other studies that are out there, look, hydroxyapatite is naturally occurring as part of your enamel. It's no wonder that you might find these particles in different parts of the body. I think the question to ask too, though, is correlation is not always causation? Was the hydroxyapatite endogenous? Was it from your body, or was it exogenously introduced into the body? If it was exogenously introduced, were the particles coated or uncoated? So there are many factors looking at how hydroxyapatite ends up in different parts of the body. But looking at the research I've seen so far, I don't see a causational relationship between the hydroxyapatite from oral care products contributing to being found in different parts of the body. And just remember that the European Union's 8-year study looking at the specific form of nanohydroxyapatite, rod-shaped, uncoated particles of up to 10% concentrations. Nanohydroxyapatite comes in different shapes. There's a needle shape, which people have concerns about, and that might potentially be able to pass through and get to different parts of the body. But when looking at the rod form, that's what the European Union considered safe in their study.
Great, thank you. That is all our questions for tonight. So if you just want to advance to the next slide, we can show people how to get their certificate. Thank you. To receive your certificate, we kindly ask you to complete a brief post-webinar survey. To access the survey, please follow these steps. After the webinar concludes, stay online and you will be presented with the survey in your browser. You can also access the survey by clicking the link in the follow-up email that is delivered one day after the webinar. Complete the survey by answering the questions, and you will receive an email notification when your certificate is ready. Please note it may take up to 3 business days to process your certificate. If you need any help, you can email us at dace@endeavorbtv.com. On behalf of the Dental Academy of Continuing Education, Endeavor Business Media, and RiseWell, thank you for joining us today, and we look forward to serving you with more webinars soon. Good night.